What is up with plastic surgeons these days, right? Okay, I'm half kidding about that, but we need to talk about this growing trend of plastic surgeons bashing or talking smack, if you want to call it that, about non-surgical, less invasive anti-aging treatments like fillers, biostimulators like Sculptra, lasers, energy-based devices like radiofrequency and ultrasound. So what is this all about? What are they saying? Does it hold any merit? We are going to talk about that today. And hello, if you're not familiar with me, I'm Dr. Ray Hamidi. I'm a board certified dermatologist. I've been doing this for 15 years and I have a lot to say about this trend. So if you are like me, you have seen a number of videos, reels, YouTube videos, etc., Instagram, TikTok, all the things from plastic surgeons saying that these kinds of treatments really should not be done. They age you faster, that they're the worst things you could possibly do, and that you should just get a facelift instead. And in my humble opinion, they are completely off base with this. They're missing a lot of nuance. And I have a lot of respect for my plastic surgeon colleagues, of course. But in this situation, I think that they are really doing the public a disservice by steering them away from treatments that could really be beneficial, really life-changing for some people, but that might be scared to do it because they're hearing all these horrible things from trusted physicians. So today we're going to talk about the other side and we're going to get into the nuances. So what are they saying? Let's start with fillers and biostimulators. Biostimulators are injectables that help your body naturally stimulate collagen, like Sculptra. And so what these plastic surgeons are saying is that these products only make you look more unnatural. They make you look older as you age. They don't dissolve at all, and they basically build on each other and make you overdone and overfilled, and everybody should just avoid them. So before we get into whether that's true or not, let's talk about what these products do. Fillers and biostimulators largely are used to restore volume that is lost in your face when you age. And that volume loss has to do with a number of factors, but mainly it is due to loss of bone and fat, those deeper tissues of the face, that allows the overlying skin to droop and drag more because it just doesn't have that underlying support. That is a major way that we use fillers and biostimulators, is to restore that volume or to preserve it as we age. And of course, this is accelerated the older we get, especially in our 40s and 50s, especially as women, as our estrogen is declining and really plummets eventually. We are losing support underneath the tissue and losing collagen and elastin as well, and that is even contributing more to sagging. So they can be a very effective tool in our toolbox when we are dressing or even trying to prevent sagging, drooping, deep folds, that kind of thing. So let's speak bluntly. Can this happen? Can you become overfilled? Can you overdo it? Can these products stay in your skin longer than they are advertised to? The answer is yes, it can. Is that the norm? The answer is no, it is not. It really is more the exception rather than the rule, and it has a lot to do with a number of factors, which I'm going to tell you in a moment. And I'm just going to say it in those cases, which they are all over the media right now, right? Like you see these celebrities all the time that just look really terrible. They look like they're trying too hard. They look like they are older than they actually are because they're trying to look younger than they are. So I see those people too. I'm not denying that they exist, and I'm not denying that they are definitely overfilled, overdone. But that is where the nuance comes in. Does everybody who gets fillers end up that way? Of course not. Of course not. That is definitely the exception, not the rule. And so how can you have these treatments? How can you use these treatments in a way that benefits you and really, really reduces the risk of that kind of thing happening? There are a few ways, okay? The first thing that I would say is really try to go to someone that you trust. And how do you find someone you trust? It might be a dermatologist you already see for something else. Especially in the dermatology world, I know we have patients who come into us for medical treatments, for skin cancer screenings. Many times we develop a relationship, we develop a rapport, and over time, a lot of those patients, then when they do become interested in these aesthetic treatments, they get treated by us because they already know us, they trust us, and they see that we have their best interest at heart. They know that we are skilled at what we do, et cetera, et cetera. And so that is one way, is if you're already seeing a dermatologist for anything medical and you haven't really dove into the aesthetic side of things with them and you know that they offer those services at their office, I really would start there. I can't tell you how many times though I hear about patients who have a dermatologist, but then they go to their local med spa for fillers and Botox and that kind of thing. And I never really understood that, except to say that yes, those places can be less expensive because they don't have physicians treating you. But really, this is not somewhere where I would bargain shop or, use a Groupon or something with your face. You do not ever want to go to someone who has offered a Groupon for these injectables, because trust me, anyone who is good at what they do are not offering Groupons for this, okay? So another way is that you could get a referral from someone you trust. You have a friend or a coworker or a cousin or something local who has had treatment by somebody, preferably a physician. Again, if so, and you like their results, you like how they look, go to that person, get a consultation, see what they have to say about what they can do for you. Okay, so go to someone that you can trust, or that someone you trust. Okay, so that's kind of by proxy, you trust them. Okay, my second piece of advice to avoid looking fake and overdone is go to someone whose aesthetic you like. Okay, so if the person who is treating you, who's injecting you, looks fake, they look overdone, they don't have the aesthetic that you like, they look overfilled, please don't go to that person, because that tells you what they think looks good, and you don't want that translated onto your face. Okay, so that is my second piece of advice. Like how they look, like how they are maintaining themselves. For example, I have so many patients who, when I tell them that I regularly get aesthetic treatments like Botox or other neuromodulators, fillers, Sculptra, lasers, radiofrequency, all the things that I do those periodically, they are shocked. They really had no idea that I had one drop of filler in my face, because it just doesn't appear that way. And that is how I like it, and that's how I intend it. And that is how you can be as well. Filler really should be undetectable in your face. It really should not be apparent that you've done anything when other people see you, even people who know you, or even, of course, people who don't know you, but they should not know, if you didn't tell them, that you had anything done. And you should just look a bit more refreshed, a bit more youthful, etc. And that is the goal of these fillers and biostimulators, and that is absolutely achievable in the right hands. And on that note, I will say that board certified dermatologists, physicians I'm talking about now, and plastic surgeons, and in some cases oculoplastic surgeons, especially when we're talking about treatment around the eye, are the core 3 specialties that are trained from the beginning in their residency on the anatomy of the face and on these aesthetic treatments. They are really going to be your best bet in terms of getting a result that you want. And also, by the way, if there were to be complications, which hopefully there are not, but nothing is risk-free, right? But if there are complications, they are really the best equipped to handle those versus getting something done at a med spa, having a complication, God forbid, and being sent to a dermatologist to treat that, who doesn't know you, doesn't know what's been done. And I can't tell you how many times that happens, where someone is treated in an office or a facility that really doesn't know how to handle any potential complications from the actual treatments that they are doing. Okay, and so that is not the kind of place that you want to go to. You want to go somewhere who has a dermatologist, plastic surgeon, oculoplastics, someone of that ilk in their office, either overseeing or treating you. The next piece of advice for avoiding these horrible things that these plastic surgeons are talking about with regard to fillers and biostimulators is less is more. And you may know this, but it's easy to not know exactly what that means in practical use and practical life. And what I mean by that is less often. Don't treat with these fillers, with these biostimulators every 3 months, every 6 months. No, if you've never had these treatments, you want to get your base treatment done to kind of get you to where you want to be, to restore volume that's been lost. And from there, you sprinkle in little bits, smaller amounts than what you did initially, over time, maybe once a year or so, depending on how old you are and how fast you metabolize these things and how your skin and face is progressing. Really, you should be getting them fairly infrequently, okay? But I do see people sometimes who want to come in like every 3 to 6 months for filler, and that is where we can run into issues. And also, you don't need 3 syringes every time, okay? So really conservative, less is more treatment is how I want everybody to approach this. And again, if you go to someone who has that same philosophy, who has that same way of injecting and working, and really is not going to upsell you on 5 syringes of filler that you don't need, then that is the key. So again, it goes back to go to someone you trust. And also, I want you to be really clear with the person injecting you about what you want. If you want less is more, tell them that's what you want. Tell them you are happy to come back for more treatment if needed, but let's just start with less today. And that is totally fine. And the person who is treating you really should accommodate that and not try to like push more on you, okay? There is a little bit of a balance of doing enough where you see at least a bit of improvement, where you're actually at least happy to have had this treatment done and have it paid sometimes several hundred or even a couple of $1,000s for this treatment. You do want to see some improvement, but again, it's always better to be conservative, and you can add more as long as that expectation is met that you probably will need more. Another tip is you can bring in pictures of yourself when you were younger, like let's say 20s, maybe even early 30s, before there has been a ton of volume loss. And that doesn't mean that they're going to be able to exactly match that after they treat you, but it does give them an idea of what your natural youthful look is, where the volume is for you, and what really looks right on you. Okay, so those are the nuances, those are the recommendations, the tips on how you can avoid all these terrible things that the plastic surgeons are saying happen across the board with fillers and biostimulators, and those are the reasons you should never get them done. I think that does people a huge disservice because it's really scaring them away from treatment that can really be life-changing for some people. And yes, these treatments do cost money. You are going to be paying probably, again, at least several $100s, if not a few thousand, for these injectables, depending on how much you get and where you go. However, not everyone can afford a facelift, right? There's a difference between a few $1,000s and $30,000 or even $100,000 or $200,000 that these plastic surgeons are sometimes charging for these deep plane facelifts. So there is a big difference there. Not to say they don't cost money, but for many people, they are super duper worth it. And I just don't want you to be scared away because of what you're hearing online. And of course, a lot of times if you look in the comment section on those reels or those videos, you do see a lot of people that say, oh yeah, I had filler and it looks terrible now. I look 10 years older. And I will say that, again, is the exception rather than the rule. The loudest voices are always the least happy ones, the most disgruntled ones. But don't discount the millions and millions and millions of people who have had these treatments and have been super happy, and has really boosted their confidence and changed how they felt about themselves. And again, for some people, they can be life-changing, really. So that's just what I want to say about the comment section of anything that you see. And that brings me to my comment section. I want you to comment if you've had these treatments. I would love to know how it went for you. What questions do you have for me about them? And I just love hearing about your experiences. So pop that into the comments. If you have not subscribed already, please do, and I will put out more content like this. And I did not get into the ultrasound radio frequency energy-based devices on this video because this was already a lot. I want you to really take that in. But in next week's video, I'm going to talk about those devices. What are the plastic surgeons saying about those devices, and what is the underlying truth? What are the nuances there? Okay, so that is coming in next week. And if you have not subscribed already, please do. This is a new channel, and I would just love for you to subscribe. I love putting out really good, helpful information for you. And you can always let me know if there are topics you want to hear about as well. Okay, and then lastly, my new program, Radiant by Design, is officially open for registration. This is a personalized pilot program, meaning it's the first time we're launching it. We are taking 15 founding members, and in this program, you get a 100% personalized skin blueprint created by me. And what is a skin blueprint? A skin blueprint is a comprehensive plan, guidance, instruction, education centered around your skin, your needs, and your goals. And it includes both your morning and nighttime product recommendations for your entire routine. Again, all based on your skin, what you tell me about you. Also, the holistic skin health recommendations, lifestyle shifts, habit shifts, tiny, tiny tweaks that are super manageable that are going to make in the long run a huge difference in the way that you age. And so those come as well, again, based on your particular lifestyle and what you tell me. Lastly, you do get a professional treatment playbook. And that is basically the most effective, the best professional treatments that have the best data behind them for you, to get you from point A to point B, from where you are to where you want to be without a facelift. Okay, so you get those recommendations, including the timing of everything. Because it's the pilot launch, you get a giant discount for being a founding member. It is 75% off. This is never going to happen, and we are only taking 15 women. So if you want to be one of those women, click the link. I will put it in the description for this video. There's a link to go to the page for Rating by Design. You can check it out, get the information, and join there. All right, that is it for now, guys. Thank you for watching. I will see you next week.